special guests and other listeners. I'm honored by the invitation to deliver this health talk, which asks a rhetorical question. My chest hurts and feels tight and uncomfortable. Is this heartburn? In the next 30 minutes, I hope you would be able to answer this question by yourself, and hope that you would have an action plan to know what to do if this applies to you or your relatives. And I'm telling three clinical vignettes, three stories. The first story is the story of the breathless brethren. He's a 65-year-old man who woke up with an ache in the center of his chest and felt nauseous. It was Sunday, 4 a.m., following a celebration party that lasted till 1 a.m. He sat up in bed for the next 45 minutes with this chest ache, but he gradually felt better. He got up at 7 a.m., still feeling a burning sensation in his chest. I must have eaten something spicy at the party, he thought to himself. He got ready for church and was driven to church. He had to climb 14 steps to enter the church from where his car was parked. He struggled to climb because he was extremely breathless. He collapsed and lost consciousness just as he made it into the church. His brethren found him sweaty, and they rushed him to a nearby hospital. His blood pressure on hospital arrival was almost unrecordable, 55/30 millimeters of mercury. The hospital had time to take blood, and they started the drip. He was pronounced dead 1 hour later. That's the end of the first story. The next story is that of aching jaw and heavy arm. This is a 60-year-old woman with a history of diabetes and hypertension. She walks in her neighborhood for 30 minutes every morning in the company of her friend, her walking buddy. One morning, she noticed that her jaw ached after just walking for 20 minutes. She returned home and felt better. The next morning, she again felt jaw ache after walking for about 20 minutes. She tried to continue her walk, but felt sudden ache and heaviness in her left arm. Her walking buddy did not like the look on her face and brought her to the hospital. At the hospital, tests revealed that she was suffering an acute myocardial infarction, a heart attack. End of second story. Third story is that of a retired nurse with stomach pain. She's 70 years old, retired nurse. She credits herself with excellent health. I don't have any business to go to a hospital, but the last checkup she had was 5 years ago. Lately, she notices that when she climbs to the second floor of her house, she develops pain at the top of her abdomen. She believes this is stomach ulcer, and she bought herself antacids. Her reason for actually visiting hospital at this time was that She checked her blood pressure and found out it was quite high, 170 over 100 millimeters of mercury. She vehemently, on questioning, denies having chest pain. She said, I'm a nurse. I know the difference between chest pain and abdominal pain. Her initial assessment was unremarkable except that ECG showed signs of left ventricular hypertrophy. So she underwent stress test, which was abnormal. That's the end of the third story. About the topic I'm trying to introduce, which is chest pain syndromes. And these are things that cause chest pain, which could have diverse causes from the very life-threatening problems to the mundane ones that are of very little significance. But the topic at the moment is to talk about heart. So the synonyms for chest pain, which might be related to heart attack, are shown here. Could range from someone saying, I have chest tightness, or peppery sensation in my chest, or chest heaviness as if an elephant is sitting on my chest, or chest and jaw ache, heartburn, or left, the chest is squeezing and there is pain that is radiating to the arms, especially the left. These symptoms on their own may not mean much, but when they are associated with other things, like the things shown here, they are associated with breathlessness, associated with fast or erratic heartbeat, associated with nausea or vomiting, or the feeling that the room has no air, or cold sweats, dizziness, and then unexplained tiredness. If the symptoms that suggest chest pain are associated with any of these, then they get escalated to a level that requires attention. What is this thing called heart attack? Here is a picture of the heart, and this arrow shows a segment of the heart that is blown up here. Heart attack happens when there is blockage of segment of the heart muscle. So you can see this segment here that has this yellow part, which is the lipid core, with a white cover that shows the cap to the lipid core. But you could see that this has now been capped with a blood clot, which prevents blood that is traveling in this direction from going past this blockage, which means that the area behind this blockage cannot receive blood. So in this area, for example, that area cannot receive blood and it suffers irreversible damage if this blockage is not relieved within 4 hours. This is what is called heart attack, permanent irreversible damage to the heart muscle. If this blockage happens at a higher level, where a large area is at risk, then the extent of the heart attack is so great that it is not survivable. So, this journey that culminates in heart attack, it doesn't happen just like that. It's a journey of several decades. We were all born clean, but after that is downhill. We get polluted and corrupted and everything. Same is true of the arteries. This is what the artery of a newborn looks. And I can tell you with authority that anybody who is listening to this message here now, does not, nobody who is listening to this has artery walls that look like this. Not possible. However, there's a long time between this point and this point, which is an autopsy specimen, where the lumen has now been completely blocked with a blood clot. And this was a major artery of the heart, and it was fatal, and that's why this is an autopsy. There is a significant number of decades between going from here to here. So the stages, and as I said, there is nobody listening to this that has completely clean endothelium. So we all have this, the cholesterol in our body, the bulk of which we didn't eat. We just inherited the genes for it. It builds up as plaques. And as long as these plaques are sheltered by this blue rim here, which is called the fibrous rim, that separates it from what normally traverses inside the vessel, which are the blood cells, the platelets, and all that. It is possible to have this, which grows and grows and grows, and you have absolutely no awareness of it. And this is the stage that all of us are, thanks to the grace that we have not to feel that. As a matter of fact, small disturbances of the rim can happen. And what usually happens is if this lipid core mixes with blood, it sets up an explosion of reaction that attracts other cells and form blood clots. It's as if it sends a signal to everybody passing by that there's a party here. Come one, come all, come and party. If that party is not terminated soon enough, then the congregation could block the street and cause what we call a heart attack. But luckily, that doesn't happen majority of the time. And little disturbances like this will happen. And the consequence of this is that this plaque will get bigger and it will keep expanding. And it's possible that this plaque could expand all the way to block this particular segment of this artery. And the person in whom this is happening will not be aware of it. This is why it is possible that we could have autopsy studies that shows somebody who died of natural causes had all major arteries blocked, and they were oblivious to it during their lifetime. People are not always that fortunate. Sometimes the party is so aggressive that some of the participants of the party, that's the cells that congregate and the blood clots that start forming because of them, break off. And these ones that migrate can migrate to other arteries that are downstream that are of smaller caliber. And these are the ones that will cause small damage to the heart muscle, but not significant. And these are the ones that have angina. And if this is happening very recurrently, that is unstable angina. But if the extent of this congregation is so drastic, it is possible that a plaque that only occupied 20% of the lumen go all the way to 100% within minutes or hours and cause a massive heart attack. So now you know this process. The objective of anybody that sees a patient with this complaint is to quickly identify what is going on. And it is not only heart attack that is dangerous, that can cause similar symptoms. The heart that is failing, either because of inadequate blood or the heart going very fast, or as a result of previously unrecognized damage to the heart muscle or damage to the heart because of valve, can go into failure, and the person would have symptoms like this, and that is also significant. But the one that is equally important that we ought to pay attention to is the lung attack, heart attack, lung attack. That's called acute pulmonary. Here is a picture of the lungs, and is similarly, if blood clot stops blood flow to segments of the lungs, it damages those segments. And if that clot is not disturbed or moved within certain period, it will cause permanent damage. If this clot happens in the major part of the pulmonary artery, it will cause sudden death. So you have people who looked previously well, they have risk factors that cause their heart, their blood to clot, and everybody says they were just doing well and they just died. So, the objective of any institution where a person who has these symptoms should be able to do in a matter of, as a matter of urgency, they have to be able to perform electrocardiogram to see if the electricity of the heart suggests that the heart is getting damaged. They have to be able to perform blood tests that will show if the heart muscle is being damaged, but blood tests that will show if blood clots are being formed in any place, either in the heart or the lungs, and other things that can show whether what is happening has consequences on the kidneys and other organs. And if necessary, they need to be able to have imaging tests that will show what the extent of the problem is. So the take-home message, if any, from this talk for everyone who is listening is that if there is suspicion that there's serious chest pain, which may be related to heart attack, if you find yourself where the tests that need to be done to identify what is happening cannot be done, please relocate yourself as possible. The chest pain dogma is this. It's actually called time. The acronym of chest pain dogma is time. Now that means time is myocardial necrosis. Necrosis is a Latin word that means cell death. Myocardial, so time is heart muscle death. But if you want to simplify this to common day language, you just say delay is dangerous. So this is the point I am making. Don't find yourself where there's going to be delay. When you have symptoms like this is not time to be evaluated for malaria and typhoid. Go to centers that can do the test that would determine what is going on. And the test may just show there is nothing serious going on and you will be at peace. So now that I have told you what the pathology of a heart attack is, let us recap the 3 vignettes that I presented earlier so we can identify the critical points about each one of them. So the 65-year-old man had chest pain. He called it ache. But the difference between this and other regular chest ache was that there was nausea associated with it, which elevated it to a different level. Heart attack is usually triggered by something. It could be activity, it could be celebrations, extreme happiness, extreme sadness. As a result, people who won the World Cup, they will have a heart attack because they are extremely happy. It is also possible that the pain will wax and wane. So this feeling a little better really was a red herring. But in this man, the pain continued for 3 hours. And although the person thought that he had a heartburn, unfortunately, that wasn't the case. Now, he had to perform exercise, climbing stairs, 14 steps, which put more strain on the heart that was struggling. And that was manifested by extreme breathlessness. The sweatiness that his brethren found was manifestation that he was already in shock, which was proven when he arrived at the hospital with a blood pressure that is extremely low. So the epilogue of this was that the blood that was taken from him was analyzed for troponin, and it showed that troponin levels, which is the substance released when heart muscle is damaged, was 500% of the upper limit of normal, which means this was a substantial damage. That's why it is not survivable. So even in the United States of America, between 60 to 90% of people who have a heart attack at home don't make it alive to the hospital. So he probably did not have a very good chance, but his chance would have been better if he went to hospital at 4 a.m., not wait till to go to church and to put more stress on the heart. That is the lesson for this story. This 60-year-old woman has what we call risk factors, diabetes and hypertension. And what was good about her was that she exercised regularly. So she could tell that something new was happening to her because she developed jaw ache and during walking at an interval that was less than what she normally previously tolerated. And it was good that she walked in company. And then when this repeated itself the day after, she just tried to walk through it. She did not succeed because new symptoms, heaviness in the arm, developed. So her friend obviously saw that something wasn't right. This was a good story because when she reached the hospital, her ECG showed that she was in the throes of a heart attack. And she went through cardiac catheterization. One of her major arteries was blocked. The artery was opened without cutting her up, and scaffolding called stent was put in place, and she went back to her work 1 week later. Good story. The third story, what was remarkable about this 70-year-old retired nurse was that although she claimed to be healthy, that was claimed without any proof because she had not had any checkup in 5 years. And there shouldn't be anybody who is 30 years old or, or older who would boast that they have not been in hospital and they do not have anybody checking their vitals, their blood pressure, their cholesterol, their blood sugar level. There's nothing to boast of to say, I am not sick, I don't see a doctor. That's actually not smart. So this person, she noticed that she had symptoms of pain, although it's located in the abdomen, but was consistent when she attempted to walk up the stairs of her house. And apparently, she now found out that she was hypertensive. We don't know whether this hypertension has actually been happening to her longer than the time she knew. In any case, she got into hospital, and the only thing that was found was voltage criteria on the ECG that she had enlarged heart, which was consistent with the history of hypertension. When we see things like that, because of her age and because of the symptoms and because of the risk factor of hypertension, even if nothing is obvious, we have to test. So she underwent a stress test, which was flagrantly abnormal. It lasted only 90 seconds. It was abnormal. And the test then led to her performing a coronary angiogram. And the coronary angiogram showed that all three of her major arteries were blocked. These are not the types, so this is not the type that can be treated with angioplasty. So she had coronary artery bypass grafting, so surgical rewiring of her heart, and she went back to her normal life. What does the management of acute coronary syndrome involve? That's not the topic of this conversation. The responsibility of any place that someone who has acute coronary syndrome attends include the things listed here. Not only must we be able to take care of the immediate pain and the discomfort, we have to identify what the diagnosis is. And like I said, there are other things than heart attack that can be serious and cause this problem. Then there has to be treatment that is implemented to try to arrest the problem. And treatment that, if there's a blood clot, that is meant to get rid of the clot within a timeline of less than 4 hours so that permanent damage does not happen. And then there is need to look for the complications of the damage that has already occurred. So again, I'm reiterating that if you or your loved one find yourself in a place where these things could not be done, request to be referred. While someone is going to the hospital, it is reasonable to give aspirin, the baby aspirin, crush and swallow. But please do not delay going to the hospital because you are looking for aspirin. And do yourself and the community a favor. Do not drive yourself to the hospital, because somebody who is having a heart attack could faint while driving and could do a lot of damage, not only to their car, but they could damage other people. So it's a community service not to do that. Have discussed now what causes heart attack, how it happens, what has to be done in the immediate period following heart attack. But you know, what I have just done is really not consequential. I am like this. So I am the regulator that is trying to teach the owner of this stable how to make these stable doors strong in order to keep the horse in the stable. But the horse has already bolted. Here I am trying to help close the stable door, but the horse inside the stable has left. And what I mean is, yes, I can talk about all these fancy things, but this is not likely to make a ton of a difference to the majority of people. So let me show you a glimpse of, and I'll go back to the statement I made earlier on, that there are decades between when we are born and when the problems start. Here are the stages. So we were born like this with the inside of all of our arteries absolutely clean, and I can guarantee you that nobody who is listening to me now who has this, unfortunately. But there is this stage in our early life before we become teenagers, where, well, these things are still not causing any trouble. But from the teenage years, we now start growing these plaques, which increase progressively over time. They don't cause any symptoms, so we are not aware of the problem. And then there are even periods when some of these things happen. The plaque is disrupted, but luckily, whatever happens does not completely block the artery. Everything I have told you that we need to do is targeting these advanced stages. What if we could do better? Produce this study called the PDAY study. It's actually an old study published about 23 years ago. And PDAY stands for Pathobiologic Determinants of Atherosclerosis in the Young. And this was an autopsy study that was performed at 17 centers in United States and Canada by coroners. And they took young people who died of unnatural death, motor vehicle accidents, gunshot wounds, suicide, not from heart disease, cancer, or any of the things. And they decided to look at specimens of their heart arteries and the big arteries they call the aorta. And they used the mechanism similar to what I showed you just a moment ago to quantify how much of the lumen is occupied by plaques. They also identified what we call traditional risk factors. Those who had high blood pressure, who were smokers, who were obese, who had high cholesterol, and those who did not. And I want you to focus on the graphs on this extreme right column. I want you to also note that each of these bars are stratified from age 15 to 19, age 20 to 24, 25 to 29, 30 to 34. And just see the different types of plaques that I showed you earlier on. There is a progressive increase. That starts at age 15. Obviously, it started before age 15 because you can see it at age 15. And it increases progressively with age. Obviously, the more serious ones are not as, the percentage is not as high as the lipids, fatty streaks. But what I also want you to notice here is that at each age level, those with risk factors that are preventable, high cholesterol, high blood pressure, they did not show diabetes here, but diabetes is in this group too. They had disproportionately higher risk, or they had percentages of their artery covered by plaques compared to their age mates that just are similar age with them. Therein lies an opportunity to make a significant difference. And the modern technology has brought us closer than ever before to being able to make this difference. Imagine a new world. This is a glimpse to the future where we have the technology now to give teenagers one injection a year that can lower their cholesterol from wherever it is to the level it was at when they were born. We can encourage and incentivize and use whatever means teenagers will respond to help them to stop smoking. And this also includes to stop them using drugs. If we can identify teenagers that have high blood pressure, that are above the numbers that their peers have, even if it is not hypertensive yet, and we can use modern methods, which does not require taking pills. We could denervate them, we could stimulate their carotid sinus, we could do all kinds of things. We could tell them to eat less salt, we could advise them on losing weight and exercise. We can lower blood pressure in these people so they don't manifest hypertension. And then we get them to eat right and exercise so they are not obese. If we do all these things, we could stop everything we are doing for them by the time they are age 50. And they will not have a heart attack until they are 90 years old or older. And also ditto for stroke. This is the future, and it is right on us. So remember where you heard this from when this becomes the reality very, very soon. So heart attack is caused when arteries of the heart are suddenly blocked and blood flow to certain parts cease. But the damage caused by a heart attack can be mitigated if this problem is resolved within 4 hours. The symptoms of a heart attack can be typical or atypical. It's not so, not everybody will have what they describe as chest pain. It can be described in all kinds of ways. But the symptoms that really should merit additional attention is when they happen in conjunction with other things like cold sweat, vomiting or nausea, dizziness, feeling the heart is not behaving well, etc. So from this, and the answer to the rhetorical question that is the topic of this discussion is, if you have chest pain and chest tightness and you are uncomfortable, please do not assume it's heartburn. Just get checked. But the second most important, if you are taken to a hospital that cannot promptly determine what is going on, request to be referred elsewhere. Thank you very much.